Hello dear students, we will be talking about Pharmacology-II BP 503T Unit 5, and we will be first talking about androgens and anabolic steroids. This unit, first part of the unit, will deal with the pharmacology of various sex steroids, and I am Dr. Monica, Principal and Professor at AKtU, Ghaziabad, at Department of Pharmacy. So, this presentation, we will first be talking about androgens and anabolic steroids. This presentation will take you through the classification of androgens and its related drugs. We will also understand how the release of the secretion of androgens is regulated. We shall explain the pharmacological basis for the use of androgens and anabolic steroids in various pathological conditions, and we will also list out the therapeutic uses, adverse effects and contraindications of androgens and anabolic steroids. So, let us start with androgens and anabolic steroids. Now, before we go in for the about the drugs, what are their mechanism of action, what is their kinetic properties, what are their uses and what are their adverse effects, it is first of all very important to classify the category of the drugs. So, the androgens and the related drugs, we classify them into three major classes. One are the androgens, anabolic steroids and anti-androgens. The androgens, they can be the natural ones or the synthetic ones. Natural ones, they include testosterone, dihydrotestosterone and androsterone. Synthetic ones, they include methyl testosterone, fluoxymesterone and the anabolic steroids, they are methanoidinone, nandrolone. We will be talking about these drugs when we continue with our subsequent presentation. Then the anti-androgens, they are ciprofloxacin acetate and 5-alpha reductase inhibitors, the finasteride drug. So, we will be first talking about the androgens. Now, the testes, the Leydig cells of the testes, they are the ones which synthesize the testosterone, and the testosterone is the most important androgen, and it is synthesized from cholesterol. The starting material for the steroids, for sex steroids, is cholesterol. Then this testosterone, by the enzyme 5-alpha reductase, this is converted into dihydrotestosterone in the extraglandular tissue, which is responsible for the major actions which are produced by the testosterone. Then adrenal cortex, it is also responsible for release of certain androgens which we call as dihydroepiandrosterone and androstenedione. We call them as weak androgens. In itself, they are inactive, they do not have any activity, or a very less 1/30th or 1/20th of the activity of testosterone. But the weak activity which is derived, that is from the conversion of this testosterone. Then ovary in the females, that also produces very small quantities of testosterone. So, we will be talking about, since testosterone is the most important androgen, so we will be talking about testosterone, taking it as a prototype drug. Now, we already talked about that this synthesis for the testosterone, the starting material is the cellular cholesterol, which then further cleavage of the chain, it is converted into various compounds and it produces the testosterone, which is the final compound. Then this testosterone is again further converted into estradiol and into other compounds which we will see it just now. So, this androgens if we see what are the targets of action, this testosterone by this enzyme 5-alpha reductase, it is converted into dihydrotestosterone, which is responsible for the major actions of testosterone. Then this testosterone by the enzyme aromatase or cytochrome P19 aromatase, it is also converted into estradiol, which acts on the estrogen receptor, and it is responsible for certain actions. Then this testosterone, it also directly acts on the androgen receptors, and it produces certain actions. Then this dihydrotestosterone, it acts on the androgen receptor and produces the actions. So what actions are produced by dihydrotestosterone? By acting on this androgen receptor, it has action on the external genitalia, that is all these organs, they mature during the puberty. Then also the hair follicles growth is also occurs during puberty, and this action is generated by this dihydrotestosterone, which acts on the androgen receptors. Then this testosterone, when it directly acts on the androgen receptors, it is responsible for development of internal genitalia, responsible for development or increased mass in the skeletal muscles, responsible for erythropoiesis, we will talk about it just now. Then it is also responsible for the bone growth. Whereas this testosterone, which is converted into estradiol, it acts on the estrogen receptor, and its main action is on the bone, where it leads to the epiphyseal closure, or it is also responsible for increase in the libido. So that is how the testosterone, which is the main androgen that acts through various receptors and its various targets. We will now see how the secretion of this testosterone is regulated. We know that hypothalamus is responsible, it is connected with the pituitary gland, with the anterior pituitary. This releases the gonadotropin releasing hormone, acts on anterior pituitary, and this anterior pituitary releases two hormones, FSH and LH. FSH is the follicle stimulating hormone and LH is the luteinizing hormone. So this luteinizing hormone, it acts on the Leydig cells and is responsible for secretion of testosterone, whereas this FSH, that is the follicle stimulating hormone, that acts on the Sertoli cells and is responsible for the spermatogenesis, that is production of the sperms. So when there is increased secretion, the negative feedback, it inhibits the anterior pituitary to release further hormones, and similarly when increased here FSH, it again negative feedback only till the anterior pituitary, whereas this testosterone secretion, when there is a negative feedback, it can also produce a negative feedback action on the hypothalamus, so that no further gonadotropin releasing hormone is produced. So that is how the secretion of testosterone is regulated by the Leydig cells. Now coming to the physiological and the pharmacological actions of androgens, we have just seen that how the testosterone by conversion into estradiol and also into dihydrotestosterone, it produces its action through various receptors. So what are the various actions or the pharmacological actions? The most important action is on the reproductive action. We saw that it is responsible for the growth, development and maintenance of the primary genitalia as well as the genital tract, and also the development of all the secondary sex characteristics in the boys. Then it is also responsible for the early stages of the pubertal development in the girls also. It promotes spermatogenesis by release of follicle stimulating hormone. Then it also regulates the neuroendocrine regulation, and that is how it stimulates libido. We saw that it is through estradiol. Then it also has the metabolic and hematological actions, where it promotes the erythropoiesis, that is RBC development is increased. It also decreases synthesis of certain clotting factors. There is increased sebum production in skin, which can lead to various acne. Then it also decreases synthesis of HDL cholesterol and increased synthesis of LDL cholesterol, and also it is responsible for the androgenic alopecia. Alopecia is the baldness, that is which is the male pattern baldness, that is called as androgenic alopecia. That is also one of the action of pharmacological action of testosterone. Then it also increases bone density. Now the question arises, how do these drugs, they produce their action? We have seen the targets, they act through various receptors. What is this receptor and how do they produce their actions? Now all these drugs, dihydrotestosterone, testosterone, they produce their action via the receptors which are called as the androgen receptors, which are a class of the nuclear receptors. Now these receptors, when they bind to the when the drug it binds to the receptor, androgenic receptors, there is a conformational change. We can see it here. It binds to the androgenic receptor here. Then it undergoes conformational change and it forms the dimer. Dimer means it becomes do ban jayenge. Then this dimers, they then translocate into the nucleus and it binds to the target promoters, which is called as the HRE, and this then causes the transcription or the gene expression, and that is how the action of this testosterone is produced. So they are the nuclear family of the nuclear receptors. Now coming to its pharmacokinetic properties, these androgens, they are not active orally, they cannot be given by oral route. Why? Because they undergo very high first pass metabolism. Therefore, oral route is not preferred, they cannot be given by the oral route. So we can give them by intramuscular injections, or if oral route by the drug is to be given by oral route, then we can use various synthetic preparations are used. Then these drugs, they are bound to the plasma protein, to the albumin, and also to SHBG, which is sex hormone binding globulin protein. 98% of the drug is bound to these proteins. Then they are metabolized by the liver enzyme, and they are excreted by urine after conjugation. They undergo conjugation reactions and are excreted in the urine. We can see it here that testosterone, it produces certain active metabolites and it also produces inactive metabolites. So active metabolite, we have also already seen that by this enzyme 5-alpha reductase, it produces dihydrotestosterone, which is responsible for its most of the actions. Then by this aromatase enzyme, it produces estradiol, which is again a active metabolite. Then the inactive metabolites, they are androsterone and ethiocolenolone. Fine. So these two are the inactive metabolites which are produced by the testosterone. Now coming to what are the therapeutic uses of androgens. These androgens, generally they are used as the replacement therapy. In this case again, we can use derivatives of testosterone. Generally synthetic androgens are not used. These derivatives of testosterone, they are safe, effective and easy to monitor, so they are used. Now what do we mean by the androgen replacement therapy? Whenever there is an androgen deficiency which is confirmed by the clinical diagnosis by carrying out various hormonal assays, in which case it could be due to certain testicular disorders, or it could be due to hypothalamic pituitary disorders. There is a low luteinizing hormone and low testosterone level. So in that case, the goal is to mimic the normal testosterone concentration as closely as possible, so that the proper concentration of testosterone is maintained in the serum. So in this case, so the aim is to restore the tissue androgen exposure by using the natural androgen testosterone. Then it is also used in case of hypopituitarism. This is done by maintaining all at the time of the puberty, the level of the hormones are maintained. Then it can also be used in case of AIDS-related muscle wasting. In that case also these androgens or the testosterone can be used. Now these androgens, they can lead to various adverse effects also. The most important adverse effect is the virilization, that is, if it is given in a woman who receives these androgens for a very prolonged period, it can lead to virilization, infertility also, and it can also lead to mammary gland carcinoma, that is the carcinoma of the breast. Then it can lead to cholestatic jaundice, generally produced by the steroids which possess the 17 alkyl substituted group. Then it can also lead to oligospermia, that is decreased sperm count. It also promotes salt and water retention, which is called as edema. It can also lead to precocious puberty, early onset of puberty, which can lead to short stature because estradiol, it leads to the fusion of the epiphysis. Then it leads to severe acne, and can, in severe cases, it can also lead to hepatic carcinoma, that is the liver cancer. Then so this was all about the testosterone, where we talked about its mechanism of action through androgenic receptors. We talked about its target. It is converted by 5-alpha reductase into dihydrotestosterone, and by the aromatase enzyme it is also converted into estradiol, which is responsible for the fusion of the bones. Then we are now going to talk about the anabolic steroids. Now what are these anabolic steroids? Now these anabolic steroids, they are the synthetic androgens. They have higher anabolic activity and lower androgenic activity, generally in the ratio of 1:3, that is low anabolic and low androgenic activity. So if these drugs are given, they do not cause virilizing effect, or they cause a very decreased, very minimal virilizing effects are seen. These anabolic steroids, they act on the same receptors, that is the androgenic receptors. They have the same androgenic effects as we talked about the testosterone or the androgens, and they have got the same anabolic effects, but these are synthesized in such a way so that all the androgenic effects, they are in the lower, they cause less androgenic effects. And the drugs which are in this category, they are nandrolone propionate, a very common trade name is durabolin, then nandrolone decanoate, then another drug is the stanozol. Now, where are these anabolic steroids used? Now, these anabolic steroids, since they have the anabolic, more of the anabolic action and less of the androgenic actions, so they are used in case of the catabolic states. Catabolic states means जहाँ पर भी ज़्यादा breakdown हो रहा है, they are called as the catabolic states. It can be used in trauma, in certain cases of acute illness, in cases of major surgery, in which case the persons are highly undernourished, or in certain cases where there is a debilitated sense of well-being. Or it can also be used in case of osteoporosis, especially in case of senile or in case of postmenopausal women, or if there is a suboptimal growth in children, that is, the growth is not proper, in that case anabolic steroids can be used. Or there is some hypoplastic or hemolytic or any malignancy associated anemia, anabolic steroids can be used. Or if there is a renal failure, in certain cases of renal failure, anabolic steroids are also used. But these anabolic steroids, they have the limitation that they are a drug of which can cause abuse potential, since they are used to enhance the physical ability in athletes and increase the strength in the exercised muscles. They are generally abused by the athletes for increasing the performance, and they are also in the list of the dope test which is performed on the athletes before any competitions or before any athletic activity. So this anabolic steroids, they have a abuse potential of being used to increase the strength of the muscles in case of the by the athletes and included in the dope test. Now, what are the adverse effects of the anabolic steroids? These anabolic steroids, they were developed with the idea to avoid these virilizing side effects, but to retain their anabolic effects. But they can cause jaundice, they can worsen the lipid profile of the drug, and the contraindications of these drugs are, that is, contraindication means that the conditions where these drugs should not be used. The contraindications are they should not be used in case of prostate cancer or in case of liver or kidney disease, and during pregnancy these drugs should not be used because it can lead to the masculinization of the female fetus. Then in certain cases of CHF, congestive heart failure, they should not be used because it leads to edema, and it can also worsen the epilepsy or the causes of migraine. Then we have the drugs which are called as anti-androgens. Now, anti-androgens, since we saw that there are certain undesirable effects of androgens, so these drugs have been developed to inhibit the synthesis or the effects of these androgens. Now, these anti-androgens, they are inhibitors of testosterone secretion. These inhibitors of testosterone secretion, they can be analogues of gonadotropin releasing hormone, where these drugs, they inhibit testosterone secretion by inhibiting the luteinizing hormone secretion, or they downregulate the receptors. Then there are certain antifungal drugs also like ketoconazole, which can be used as anti-androgens, or they can inhibit the secretion of testosterone. Then another type of drugs are which are inhibitors of androgen action. Now, these are the drugs which inhibit the binding of androgen to the androgenic receptor, or they inhibit the 5-alpha reductase enzyme. Now, there are certain drugs which are called as the androgen receptor antagonists. These androgen receptor antagonists, they are flutamide, and these other drugs are also there. We will talk about flutamide, and they are the potent androgen receptor antagonists. They have limited efficacy when used alone because the increased luteinizing hormone secretion, it stimulates the higher serum testosterone concentration. So they are generally used in conjunction with the gonadotropin releasing hormone analog in case of the treatment of the prostate cancer. So they block the action of adrenal androgens which are not inhibited by the gonadotropin releasing hormone. Then there are certain anti-androgens like spironolactone, which is an inhibitor of aldosterone and also a weak inhibitor of androgenic receptor. They are also used as anti-androgens. Then there is another drug which is cyproproterenone acetate. This is also a progestin and weak anti-androgen by the virtue of its binding to androgenic receptor, and it is moderately effective in reducing the hirsutism. Hirsutism means excessive hair growth. Then there are certain drugs which are called as 5-alpha reductase inhibitors. These 5-alpha reductase enzyme, if we recall that it is used to convert testosterone into dihydrotestosterone. So the drugs are finasteride and dutasteride. These are the antagonists of the 5-alpha reductase, and they are used in the treatment of the benign prostatic hyperplasia because these enzymes, they are present in the prostate glands. Then there are certain other androgens which are anti-androgens which are called as denazole. Then these phosphodiesterase inhibitors, they can also be used in the treatment of erectile dysfunction by these phosphodiesterase inhibitors like sildenafil. They inhibit the conversion of cyclic GMP, and that causes that is the basis for their use in the erectile dysfunction. So these are the phosphodiesterase inhibitors. The mechanism, the drug is sildenafil. So they compete for the cyclic GMP binding site at the site of this GMP hydrolysis. So that is all about our lecture on androgens and anabolic steroids. These slides, they present all the drugs which can be used as in androgens in various conditions, various preparations. So that is all. Thank you.